Hi everyone. Today I am going to deliver the topic of myocardial infarction. The case scenario of myocardial infarction is a 57-year-old male lorry driver presented to his local emergency department with a 20 minutes episodes of diaphoresis and a chest pain. The chest pain was central, radiating to the left arm and crushing in nature. It was settled after the GTN and 300 milligram of aspirin orally in the paramedic community. He smoked 20 cigarettes daily, 38 pack years, but was not aware of any other cardiovascular risk factors. On examination, he appeared comfortable and was able to complete sentence fully. There was no heart murmurs present on a cardiac auscultation. A blood pressure was 180 per 105 mmHg. The heart rate was 83 bpm per and regular oxygen saturation was 97%. So what is the most likely the diagnosis is? The definition of myocardial infarction. First, the myocardium. The myocardium is the middle layer of the heart. When the plaque is occluded due to some deposition of fatty acid, the blood flow is not able to flow freely. So the obstructions will be there. That is called the infarctions. The ischemia which leads infarction. Ischemia means decreased blood flow to the particular area. Infarction means stoppage of the blood flow to particular area. So myocardial infarction refers to the process by which area of myocardium cell in a heart are permanently destroyed. The definition of myocardium is myocardial infarction is decreased condition which is caused by reduced blood flow to the coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombi. The embolus or thrombi both are blood clots, but thrombus is the immovable blood clot. Emboli is the movable blood clot. It can move throughout the circulation in our body. There are three types. One is anterior or septal wall myocardial infarction, another one is posterior wall or lateral wall MA, and final one is inferior wall MA. The types of infections are two types based on pathology. One is transmural infections, another one is subendocardial infections. The risk factors of myocardial infarction is unhealthy diet, lack of exercise, obesity, smoking, mental stress, excessive alcohol, hypertension, diabetic, and lipid level increases in blood. The etiological factors are caused based on two types of risk factors. One is modifiable, another one is non-modifiable. The non-modifiable risk factors are age more than 40 years, family history, and gender. The modifiable risk factors are high cholesterol level in blood, high blood pressure, smoking, diabetic, obesity, physically inactive, and poor nutrition. The pathophysiology of myocardial infarction: due to any cause, the atrial spasm will be there, which leads to sudden reversible obstructions, which leads to ischemia. The ischemia is decreased blood flow to the particular area, which leads to hypoxia. Hypoxia means decreased oxygen level in a blood, which leads to decreased oxygen demand, which leads to thrombolysis, which leads to permanent thrombus, which leads to necrosis. That is called myocardial infarction. The complication of myocardium infarction is arrhythmia, cardiogenic shock, congestive heart failure, thromboembolism, rupture, cardiac aneurysm, and pericarditis. Another one is clinical manifestations. The characteristics of myocardial pain is severe immobilized chest pain, tightness, heaviness, pressure, and burning sensations. The location: substernal, retrosternal, or epigastric region. The radiation of pain due to neck, jaw, arm, or back, and the duration lasts for 20 minutes or more. And nausea, vomiting, fever more than 100 degree, cardiovascular manifestations of hypotension, shock, urine output, oliguria. The sympathetic nervous system stimulates increased catecholamine release, decreased profuse sweating, so which leads to cold sweat. These are the clinical manifestations of the myocardial infarction. The diagnosis of myocardial infarction is basic history collection and physical examinations, and moreover the cardiac markers are elevated. An ECG showed T wave inversion, ST segment elevation, and abnormal Q wave. The angiography to detect percentage and blockage of percentage and type of myocardial infarction. Chest X-ray to detect the cardiomegaly. A nuclear stress test and the isotope scanning also can be done. The management, conservative management of myocardial infarctions of lifestyle modification, cessation of smoking or alcohol, diet and nutrition, salt restriction in food. The medical managements are thrombolytic agents, anticoagulants, antiplateletics, antihypertensive agents, lipid lowering drugs, vasodilators, and other analgesic, anti-ulcer drugs, and antidepressants. Initially, the treatment was started with morphine 2.5 to 5 milligram IV for sudden relief of pain and anxiety, aspirin 162 to 325 milligram orally for prevention thrombus extension, embolism, venous thrombosis, inhalation and assisted respirations if needed, IV fluids, maintain body volume and perfusions. There are two interventions are there. One is percutaneous intervention. Percutaneous coronary intervention is the non-surgical procedure used to treat narrow of the coronary arteries of the heart found in coronary artery disease. Another one is coronary artery bypass grafting. It is construction. It is the common surgical procedure for the treatment of myocardial ischemia. The use of artery or vein to pay the patient to anastomose from aorta to the distal end of the stenosis so that the blood flow can directly supply the distal myocardium throughout the graft, thereby achieving the purpose of treating myocardial ischemia. Now, the conclusion part is we saw the case study, right? That is the empathy part, and intro and patient's assessment are the defined part. Clinical manifestation is the ideate, management and prognosis are evolved, and prototype is the investigations part. Thank you.